Hi and welcome. In this short video today, I want to talk about chronic pain and acute pain. So, what are the differences between chronic pain and acute pain? I know many of you feel chronic pain or not sure if this is okay to still feel the pain. So, we will go over this today in this presentation. So, acute pain and chronic pain is basically the pain is the same, we could say. Pain is always in the brain. The brain is processing the pain, and there's not much different if it comes from acute pain or from chronic pain. But of course, in the case of acute pain, there is a reason for the pain. And I'm not saying that for chronic pain there's no reason, but oftentimes the reason is quite hidden, or the doctor can't find any reason. This is why we have to go over this. So if you look at the presentation, if you look at the screen, you will see that the activity in the brain is very different if you're feeling chronic pain. So a lot of regions are impacted by chronic pain. And to understand the whole picture, we have to go and look at the different types of pain. So, acute pain, basically, everybody knows what it is because everybody experienced it. So, acute pain is a pain that happens. In this example, maybe you fall from your horse or you cut your finger, and it's labeled as acute pain if the pain is there for 3 up to 6 months. So after 6 months, it's going to be chronic pain because the pain, as we will see in the presentation, has a purpose. And after this period of time, there is most of the time no purpose anymore. Some studies say 3 months, some studies say 6 months. That's why we have 3 to 6 months here. And most of the time, of course, this acute pain is related to soft tissue injury or temporary illness. And acute pain can transform into chronic pain. We will do a little example here. I think it's quite logical what the difference is, but acute pain, I made up here a story. Just imagine you would walk through the wood and then you would slip over a wet stone or a wet wood piece and you hurt your knee. And this will be acute pain. And of course, the acute pain is there for a reason. You are managing to get into your car and you can manage to drive home, but you're worried a little if the knee will be okay in some days because you have plans. And luckily, the knee gets better after some days. So this would be a normal cycle of acute pain. The pain was there for a reason. The pain was there to protect you, to injure your knee even more. This is why you felt the pain. So it had a purpose. You stopped walking in the wood. You turned back home. And so the knee did have time to recover and everything went fine. So this is the normal cycle of acute pain. Could be the same if you cut your finger or whatever. The pain would be there for a period of time because it wants to protect, and then it should go away. So the facts of that are that also in acute pain, of course, we feel, or the source of the pain was the knee in this case. If you cut yourself, of course, you have tissue damage, and the brain is processing this information. We will have some slides after this to show you how the process works, how the pain gets into the brain and what the process is. So also for acute pain, the pain is processed in the brain. Of course, there's another part in the body that is hurt, but it's processed in the brain. So an example for that would be, just imagine you wake up in the morning and you are making toast. You rush into the bathroom back and you brush your teeth, and for some reason the toast gets stuck in the toaster, and then you smell that the toast is burning. You rush back, you try to get out the toast from the toaster, but you burn your finger, And then the process for the brain basically starts. What happens is that there is a signal from the finger in this case going up to the brain. And the brain has to make sense now out of this signal. What should it do? So what the brain is doing, it's looking at all the pictures, in this case, the visual cortex. So it's taking the pictures, the visual information, and trying to make sense out of that. So it sees the probably red finger or burnt finger, it sees the black toast, and it sees the smoke. So for the brain, these are clearly signs of danger. And of course, you can also feel the pain. Auditory cortex, you probably still hear, the toaster. Maybe it's making some ticking noise because it's cooling down. And you can probably also hear the coffee machine if you make coffee, or you hear some other background noises. But the brain is filtering out in milliseconds, of course, then the noises that confirm that this is still hot and could be a danger. Then the planning cortex, the brain will ask itself, what do I have planned for today or the next days? And is it very important to use my fingers? Do I have to protect this part especially, or whatever? So this is also taking into consideration. But one of the biggest points or biggest things is basically the past memory. So if you know somebody that got really hurt very badly, burning himself, if you have experienced that in the past, in your childhood or whatever, your brain will totally differently process that, because then for the brain, this is a very different situation, and it may know, or it may think there's much more risk involved in that. So this is very important. And later on, you will see that this actually leads us to the childhood in many cases. So in this case, the brain would probably decide that it needs pain now because we have so many senses confirmed that this is actually necessary to feel pain. And it's, of course, this is happening in milliseconds, and the brain will take a decision. So for chronic pain, what is the cycle for the chronic pain? Chronic pain can be very wide variety of pains. So it could be a joint pain, a muscle pain, arthritis, bone, neck, whatever. So there's many types of pain that you can feel, and a lot of times it's connected to anxiety and depression and so on, as we will see in this. Also, the facts are basically the same. It's also generated in the brain. An example of that would be you are doing a presentation for your working colleagues or for your company tomorrow, but you're missing out on an important piece of statistics, and suddenly you're getting some headache, or you're getting some back pain, or you're getting some kind of pain which will protect you from maybe going to work tomorrow. This could be a very heavy migraine, so you have to stay at home. So your body is trying to protect you to stay at home. This is possible that this worked for you in the past. So it could be that you picked that up as a child and it helped you to protect yourself as a child, as we will see. But this is very important to keep that in mind, that if the pain is getting chronic, a lot of times we see that actually there is something going on, or was something going on in the childhood, or it could also be like in an early stage of life. It doesn't have to be the childhood, it could also be experience, some dramatic experience later on in life. And the facts we said about, it's the same. The pain is always generated in the brain, because in this case, there is not really a reason for it. So it's all mentally. Another example is, which is pretty the same, like this lady, her name is Karen. She signed up to speak in public, but she's very afraid of speaking in public, but she's trying to push her. And also, in this case, her body is trying to make her stop, to protect her. So maybe she's getting neck pain, back pain, or whatever pain. In a lot of cases, like I mentioned already, this is something that worked for these people in the past already. It's very important to understand there is no real pain. If you feel pain, you can't say, so some doctors will tell you your pain is not real, but there's nothing like real or not real pain, because if you feel pain, the pain is real. It's just important. In one case, they can't find any medical issue, or it seems that they can't find an issue. And in the other case, they can. So this is the only difference, I would say. So what is the cause of a chronic pain? This is very important to see. Of course, it could be structural, but this is not in very many cases. And it could be neural pathway pain, which it is in most of the cases, what I've seen. The issue with finding out is, even if you would do an MRI, which many people do, the older you get, the more likely it is that your MRI is showing some abnormalities. But these abnormalities don't actually mean that you're going to get a problem or you have a problem. This is just normal abnormalities, so to say, which every MRI will show for people at a certain age. So it's very hard to actually find out if this is structural or not. In few cases, it may be that it's structural. In other cases, it will probably not be structural. So to identify the neural pathway pain could be like early childhood trauma or early life trauma, and oftentimes irritable bowel syndrome, neck or back pain, pelvic pain, fatigue, insomnia, anxiety, depression. This is all very connected to the pain, actually, to the chronic pain. Also, in a lot of cases, if people, don't speak out or have a lot of self-criticism or lack of self-compassion, we see a lot of chronic pain, actually. So the chronic pain will not go away. Indicators for neural pathway pain are the pain gets worse over time. So we see a lot of people taking a lot of medicine, but they need to take more and more pain medicine, and it doesn't really work. The pain spreads to new regions, which is very interesting. The pain shifts the regions. And one of the main indicators of neural pathway pain is that the pain turns on and off. So we have people that say they didn't feel pain for a year or some months, and then suddenly the pain turns on again. And this is a clear indicator of the pain is chronic, and the pain is actually related to some situation or some feeling, some emotion, and so on. The pain gets worse when there is stress, and also many times there's multiple symptoms. Like also if you have arthritis, sometimes like it's moving around. You have it in your fingers, in your elbow, in your knees, and so on. But then people suddenly have back pain, neck pain, and so on. So this is what I wanted to talk about today, which was the difference basically between acute pain and chronic pain. In the next presentation, I will talk about the pain and the purpose, which is very interesting. I want to invite you to also watch this video because I will explain what purpose the pain actually has. I hope that was useful, and I see you in the next video. See you. Bye-bye. Bye-bye.